Hi, and welcome to our Texas Health Harris Southlake Joint Camp. We appreciate you joining our class today. We want to accompany you on your upcoming journey for your joint replacement from admission to discharge and even after that. Thank you for choosing our hospital. We know that you do have a choice in your health care today, and we appreciate you choosing us for your health care needs. This hospital was opened in 2005 as a joint venture between some dedicated physicians and Texas Health, and we are here, and our goal is to provide you five-star service always. But as your healthcare team, we are dedicated to our community, our employees, and to our patients, and to provide a very high-quality, patient-centered environment. We consider y'all the reason that we're here today. So there are some advantages to having surgery here with us. We have a lower nurse-to-patient ratio. We're a little bit smaller hospital, so you get a little spoiled here. We also have a very, very low infection rate. And we're a surgical hospital. All of our patients are surgical patients, so you do share a common goal with other patients to have decreased pain, increased movement, and have increased independence. We know that surgery can be stressful, and we just want to help address some of your concerns today and let you know some accurate information about what to expect. So we'll help just make sure you understand what's going to be going on. But congratulations in your decision to have your joint replacement, and just know that having that attitude of preparation from the beginning will help you on your journey. There are a number of things that you can do ahead of time before your surgery to kind of get ready. You can do some meal prep. Prepare and freeze some meals ahead of time, put some stuff in the freezer, stock up on items that you're going to need. Also do a quick safety check around your house. Look around for any throw rugs, any plants, extension cords, or anything that might be in your way. You're going to be going home with a standard rolling walker, so you do need a clear path. Also look around for any stairs or steps outside your home and make sure they all have a secure hand railing. If all of your bedrooms are upstairs, you will need a sleeping area downstairs for when you first get home for the first few weeks. So make sure you arrange to have a sleeping area downstairs. Also, it's a good idea to measure the height of your mattress from the floor to the top of your mattress to the floor. Our beds here will go up and down. We can adjust your bed here to the same height, just to make sure you can get in and out of bed safely when you get home. So it's also a good idea to invest in a wire basket or a plastic basket for the front of your walker, just to help you carry some important items like your cell phone, cup of coffee, and that type of thing, especially if you're going to be going home alone. And most of our patients, a lot of our patients do live home alone, so let your friends and family know about your upcoming surgery. Make sure you have a coach. Make sure you have help arrived at home. Make sure you have a plan so you'll have help when you return home for the first few days. Make sure you have a family member available to help you with meal prep, bathing, dressing, and that type of thing. We are going to have several different people come during our presentation today to speak with you also. We have Jan, she's one of our concierges. She's going to be giving you a patient perspective because she's been our patient multiple times before. We have Rachel, our dietitian. She's going to speak with you also. And first off, we're going to have our physical therapy department come and speak with you about some pre-op and post-op exercises. Please remember that any activity that you can do before your surgery will benefit you afterward, any activity. So at this time, we're going to have Jan come, and then I will be back after a while. Thank you.
Hi, I'm Jan, and as Vicki said, I'm one of the concierges here, but more importantly, I have been a patient here, an inpatient 3 times, and I've had surgery 6 times. I've had both shoulders, both hips, both knees, and my carpal tunnel. And I had knees bilaterally. For those of you who are having your bilateral knee surgery, be thankful you did that, because when you're doing your rehab, then you can do both knees. And it's a whole lot easier because you'd be dreading going back and doing the second one. So congratulations, you made that decision. And trust me, it's not easy, but you can get through it. I was a flight attendant for American, so that exacerbated my arthritis, but you can see from my hands that I have bad arthritis. But now my motto is everything works and nothing hurts. But the key thing is to do your therapy, which they will tell you and explain all of that to you. Take your medicine first, but do your therapy. And if you'll do that, then you'll be so happy. And you can say, like I do, everything works and nothing hurts. And in closing, let me say, if you're coming here, be thankful for that, because as I said, I've been here a patient many times, and the first time I was here, I said I want to work there someday, and it just worked out. But best hospital in the nation, best doctors, nurses, case managers, physical therapists. The food is wonderful, and when everything is back to normal, then I'm going to be here taking care of your friends and family. So good luck on your surgery, and if I happen to be here the day of your surgery, be happy to talk with you. But you can do this.
Welcome everybody to Joint Camp. My name's Sharon and this is Libby over here. We're both physical therapists here at the hospital, and we'll be coming to see you. On the day of surgery, we'll be in there within your room within an hour, so that when we come in, don't look at us like we're crazy. This is doctor's orders. They find out that early mobilization is the best thing for you. All right? So before you come to the hospital, we'd like you to get ready and prepare yourself to get yourself a little bit stronger. I don't care if you only have a day before surgery or if you have a week or 2 weeks. We ask you to do some exercising. So one thing you can do at home is, if you have a chair, just sit down in your chair and do some exercises. Basically, you can do some leg exercises where you can kind of march in place, all right? You can raise your legs on up, swing them. If you're laying in bed, you can go out to the side, do a little bicycling. Don't forget about your arms, okay? A lot of people have never used a walker before and they'll complain about their arms hurting. So if you've got a bag of rice that's a pound, or if you've got some dumbbells, you can do some arm exercises up and down, forward, backwards, and that type of stuff. If you've got a good sturdy chair that's got an armrest, you can do what we call wheelchair push-ups. See if you can lift your bottom off the chair using your arms. If you can't, just use your tiptoes, but use your arms mostly to get yourself on and up, all right? Most important thing is to make sure you do your therapy when you're here at the hospital, and especially when you go home. We're not going to lie to you, it's going to hurt. You're going to have some pain. Take your pain pills, but the pain pills are not going to take everything away from you. All right? I do ask you to, if you have a walker at home, please bring it in. Just make sure it's got 2 wheels, no seat in the front. The doctors don't like the seats because then you have to be too far away when you're walking. Also, measure the height of your bed from the mattress to the floor, because our beds will rise up and down, and this way we can set the beds at the right height that you're going to be preparing yourself to do at home.
Hi, my name is Libby Veller. I'm one of the other therapists here at Southlake, and I just want to kind of reiterate on what Sharon had said a few times. We are here to help you. On your day of surgery, we will be in your room, just reminders, and we like to let people know that you're not sick. This is an elective surgery. We are pushy, but we're also going to be kind and gentle. So we are here to help you, and we look forward to seeing you when you come in for your surgery.
But before your surgery, your doctor is going to fax over a surgical request form to the hospital to let us know about you, your demographic information, and the kind of surgery he's going to be planning to do. You'll be contacted by one of our pre-admission testing nurses for a pre-admission testing visit, also called PAT. We have several different initials in our presentation. We love initials. But anyway, a PAT nurse will reach out to you to contact you before you so you can come to the hospital for a pre-admission testing visit. When you come, they're going to obtain from you a very thorough medical history. They're going to want to know conditions that you've had, previous surgeries that you've had, if you've had any trouble after a surgery before. They're also going to want to know about any medications that you take. We do ask that you bring all of your home medication in their original prescription bottle when you come for your PAT visit. They're going to want to know the medicines, the dose, the time of day you take it, and all of those things. If you take over-the-counter medication, any vitamins, herbs, supplements, you don't need to bring those with you. But please bring a complete list of what you take, because some of those things might need to be stopped several days before your surgery. If you take vitamin E or fish oil, something like that, the PAT nurses might want you to stop those for a little while before your surgery. But bring all of your home medications with you in their original prescription bottles. Also, if you are under the care of a primary care physician, a cardiologist, or any other doctor that you see on a regular basis, please bring their name and their office number and your pharmacy number as well. That way, if the PAT nurses need to get any information from your doctor, they'll have that information. When you come for your PAT visit, they're also going to go over skin preparation with you. It's very important, anybody having any elective surgery in the United States today, to do a skin prep. We have a certain number of bacteria on our body, and this is just a way to lessen the bacteria on your body to decrease your chances of getting a postoperative infection in your incision. But you're going to use an antiseptic solution to do that. And they will give you a kit when you come for your PAT visit. If you need to come by the hospital at any time, the phone number for PAT is in your PowerPoint. You can call them, and if you need to come by and get a kit, please feel free to do that. We have them available. Would rather you come by and get one than to need it. So please call us if you need one. But during your PAT visit too, they're going to get from you labs, x-rays, and an EKG and get everything ready for your surgery. But the skin prep is going to involve you the night before your surgery taking a shower, wash your hair with shampoo, rinse off after your regular shower, turn your water off, use half of your bottle of Hibiclens, which is the antiseptic solution. Soap your body off with half of that bottle. Don't put it on your face or your private areas, but let it sit on your body for 5 minutes. And then turn your water back on and rinse it off. Clean towel, clean pajamas, clean bed linens that night. And then before your surgery the next morning when you get up, we're going to need for you to take another shower. You don't need to wash your hair that morning, but take another shower and use the other half of your antiseptic solution. And also in your packet is a little pack of antiseptic wipes. It's the same solution on here as in your bottle. But right before you come for your surgery, we're going to ask for you to rub those wipes on your skin where your incision's going to be for a certain number of minutes. All your kits will come with specific instructions. Also in that kit is the number for case management. So if you have any questions about your skin prep or really anything between now and the time of your surgery, please feel free to call case management. We do have a confidential voicemail. If we're not able to answer, we will call you back as quickly as possible. We've also included in your PowerPoint packet information on hand hygiene. It's very important in the world that we live in today for all the healthcare employees, healthcare providers that are coming into your room to always perform hand hygiene before they come into your room. And any family members, any visitors that you may have also need to complete hand hygiene with the antiseptic hand foam outside the door. We do have dispensers outside our doors and inside our door. So if you don't see your nurse or whoever's coming into your room performing the hand hygiene, it's always your right as a patient to ask them to please stop and complete their hand hygiene before coming into your room. So please feel free to do that. But we have included that information in your PowerPoint. If you could look over that, please also. So preparing and packing for the hospital is very self-explanatory. Pack whatever you feel like you're going to need while you're here with us. Toothbrush, toothpaste, that type of thing. If you get here the day of your surgery and you've forgotten something, let your nurse know. We're kind of like Motel 6, we have some extra. So you let us know if there's something that we can get for you. You can bring slippers, house shoes, or whatever shoes you're going to want to walk in. You will be walking in the hall. But most of our patients do opt to wear the hospital non-skid socks, and they do work very well here at the hospital to have that non-skid surface. Also, you are welcome to bring your own pajamas. A lot of gentlemen just wear gym shorts and a t-shirt. Ladies, you can wear your pajamas, your nightgown, whatever you're most comfortable in. However, we do have an unending supply of hospital gowns. If you'd like to wear those while you're here at the hospital, you can wear those while you're here. They do kind of go nicely with the socks, but we do have those if you would like them. Also, please bring your glasses, dentures, and hearing aids with you to the hospital in their cases. You will need them while you're here. If you have a CPAP machine at home that you wear at night for obstructive sleep apnea, bring that with you. You'll need it while you're here in the hospital, and you'll need to bring it in with you day of surgery. They might need it in recovery room while you're waking up, so bring that with you. But just wear whatever you're most comfortable in, some loose-fitting clothes. Day of your surgery, it's also very important, again, to bring all of your home medications with you in their original prescription bottles. A lot of patients have brought their whole pill minders, the little pill box for every day. Unfortunately, we do need your pills, your medications in their original prescription bottles. Our pharmacists do have to identify every medication that's brought into the hospital, so they will all be sent to the pharmacy and then brought back to you. If you take a medication at home that's not on our hospital formulary or list, We will use your home medications to dispense to you while you're here with us. Your home medication will be kept in your room in a locked drawer. When it's time for your meds, the nurse will come in, unlock your drawer, dispense your medication to you, and lock them back up. And then when you go home, all of your medications will be given back to you. You do not need to bring pain medication. We will have pain medication to distribute to you while you're here with us. Also, day of your surgery when you're coming, if you have a living will and advanced medical directive, please feel free to bring that with you also. We can scan it into your electronic medical record and give your copy back to you, but bring that with you, please. Also, day of your surgery, you will need to bring your driver's license and your insurance card. We will need those. So the day of your actual surgery, you'll need to get up in the morning and complete your skin prep as directed. Do not apply any lotions, moisturizer, deodorant, hair gel, anything to your skin. No makeup. Brush your teeth. Don't swallow any water. If you've been instructed to take a medication the morning of your surgery by your doctor or our PAT nurses, go ahead and take that medication that morning with the littlest sip of water possible. Again, whatever loose clothing, comfortable clothing you would like to wear is perfect. Leave all of your jewelry and your valuables at home, please. You won't need those while you're here. No makeup and no fingernail polish and no toenail polish, please, when you come. When you arrive at the hospital for your surgery, you will come in the door where the big round rotunda is down at the registration desk, and you'll register there. And a representative from the pre-op department will come and get you and one family member to go back to the pre-op holding area where you will be until you're ready to go to surgery. The rest of your the rest of your family will be escorted to the family waiting area if the visitation rules have been relaxed at that time. We do ask for family members not to leave the hospital until after the doctor has come out and talked to your family. Let your family know the surgery's okay. And then at that time, it's a good time for your family to go and get lunch if they would like to have something. So that's a good time for your family to go. But once you get back to the pre-op holding area, like I said, you will be there until your OR is ready. They're going to ask you a lot of the same information that the PAT nurses have already asked you: your name, your date of birth, your allergies, all your medications. Again, they're going to go over everything with you. It's going to feel like a lot of repeat information. We're just trying to make sure we have everything correct. We take patient safety very seriously, so that's why we're so careful. While you're in pre-op holding area, you will be visited by your surgeon, by the anesthesiologist that will be with you during your case, and by the surgery nurse that will be accompanying you in your OR room. While you're in pre-op holding area, you'll sign your surgical consents, and you'll sign, they will start your IV over there for you, and your doctor is going to come in and mark your surgical site when he comes to visit you. They're going to put on you one of those white compression hose, those tight compression hose. It's called a TED hose. That's just the brand name, but it's one of those surgical compression hoses. They're going to put one on you before you go to surgery, a knee-high compression hose on your unoperative leg, and then you'll get the other matching twin the next day. So the operating room nurse and the anesthesiologist will come and get you and escort you back to OR when it's time for your case. Average length of time for surgery is between 1.5 hours to 2 hours, but you're just going to feel like you've taken a little nap and dozed off. You're probably going to feel your bed shaking and see some, lights in your face, and they're going to be patting you on the shoulder, telling you that your surgery's over, everything is fine. And when you wake up, you're going to be moved straight from your OR room to the recovery room, also called PACU, for post-anesthesia care unit. However, us more seasoned nurses, we still just call it recovery room. But that's where you'll wake up. And you'll be moved over there because immediately following your surgery, you will need to have immediate and very careful monitoring while you wake up from the effects of the anesthesia. So they're going to put several kind of monitors on you. You'll have a heart monitor on. You're going to have a little clip on your finger that's going to monitor the oxygen saturation in your blood. There's an automatic blood pressure cuff on your arm that's just going to be pumping up every once in a while. So the nurses are going to be around your bed, and it's going to feel like a lot of activity while they're getting everything hooked up to you. So they're going to ask you to do something that I think is kind of hard. They're going to ask you to rate your pain on a scale from 1 to 10. with 1 being no pain and 10 being the very worst pain. They're going to ask you to rate your pain on a scale from 1 to 10, and they're going to medicate you for pain, give you pain medication. And they're going to ask you again in a little while what your pain level is, and they want to see that number coming down. That pain scale is just a way for healthcare professionals to be able to make sure that the pain medication that we're giving you is being effective for your pain. So that's why we're asking you to do that. But the nurses are going to be checking your vital signs, your dressing. You may or may not have a drain in your surgical site. They're going to check the circulation also in your operative leg. They're going to put on you over the TED hose or the compression hose. They're going to put one of these on your calf, and it's just a big Velcro pad that's going to go around your calf. And this is just going to provide a way to help. It works with the TED hose, the compression hose, to just help move your blood back up from your lower extremities, back up to your heart and lungs where you need it after your surgery. So you're going to feel a pulse of air here and a pulse of air here on your calves. They're going to go on both of your calves. So if you feel pulse, that's what this is. And this just works with the TED hose to keep your blood from pooling in your lower extremities to lessen your chances of getting a blood clot, a DVT postoperatively in your leg. And these will go home with you even. They will go home with you. They come with a very nice battery, rechargeable. When you get up to walk, you just unplug them, and they're very easy to work with and have the Velcro. So those will be going home with you also. Also, they're going to have ice on you, whether you have the ice machine or just the blue ice bags. They're going to have those on you also. So while you're over in the PACU or recovery room, it's only separated by curtains, so generally we don't take family members over there just to ensure every patient's privacy. Usually the time that you're over in the PACU or recovery room is 1 to 2 hours, and then you'll be transferred straight from the recovery room to our lovely inpatient unit. Once you get over to our inpatient unit, all of our rooms are private rooms. They have big windows, of course, private bathrooms. Your family member, one family member is welcome to stay with you while you're here with us. All of our rooms do have a little bed that folds out into a chair that folds out into a little bed. We do have towel sheets, blankets. Your family's welcome to take a shower and stay with you. The only thing that we don't really have is food for your family members, but here in Southlake, there is every food establishment within a stone's throw of the hospital, so food is pretty easily accessible for your family. But upon arrival over to your hospital room, you might be fully awake, ready for your hospital jello. And some patients are still a bit groggy, so it just kind of depends on the person. But you may still have several types of equipment once you get over here. You may or may not still have your IV going in your arm or your wrist. If your IV fluids have been stopped in the recovery room, then they're just going to leave a little cap in your vein and tape it down with a little tube and a little cap and tape it down. That's called a saline lock. And once every shift, your nurse will come in and just flush it with some plain saline. So that will have an open line in case the nurse needs to give you IV medication. You may have a drain, like I said, in your surgical site. You may or may not have a drain, and you might have some oxygen still in your nose. You're still going to have your plasma flow to work with the TED hose to keep the blood clots from forming in your lower legs. You're going to have those. You're still going to have your ice pack or your ice machine. You know, ice is an age-old remedy, but it's still very effective to decrease pain, swelling, and inflammation, so we do still use ice. If you don't have the ice machine, and if you're having a hip, for sure you will have the blue ice freezer bags. Of course, like everything here in our hospital, they're single-use items, but once they become no longer cold, the nurses will just put them on the counter in your room. If you have a family member that can take them home and put them in your freezer at home, please feel free to send those home and have them refrozen. They work beautifully again at home. You can reuse them at home once you get home, and they're also good to keep for grandkid boo-boos there at your house. And once you get over also to the inpatient unit, the inpatient nurses are going to dispense to you an incentive spirometer. It's very important after any major surgery to keep your lungs clear. And this is just a way to help keep your lungs clear after a surgery. But you and the nurses and the patient care techs are very, very knowledgeable and will help you know how to do this. But you just put this in your mouth, close your lips around it, and take a big deep breath in. It fills up the bottom of your lungs with good, fresh, clean air and keeps your lungs moving. As you take your big, deep breath in, this blue disc is going to come up. Your nurse is going to set your blue arrow to give you your target range to get to. We're going to ask for you to do this 6 to 7 times every hour while awake. You don't have to wake up at night to do this. If you're watching TV, a commercial comes on, grab your little friend and take some good, deep, healthy, fresh, clean breaths. And the nurses, again, will help you remember to do this. But it's very important to decrease your chances of getting a pneumonia or any post-operative lung problem. So it's very important to do that. You'll be started once you get over here on a clear liquid diet. I've kind of already alluded to the hospital jello, but you will be started on a clear liquid diet, and then your diet will be advanced per order of your physician. Once we just make sure you're not having any nausea and everything is okay, all of our the diets here, the meals here at the hospital are chef prepared. So one of the dietary aides will come and see you before your meals to get your preferences. Please tell us about any allergies, any food preferences that you have, any diet that you prefer to be on. If you need gluten-free or vegetarian, please let us know. We'll do our very best to get you what you would like. It's totally normal to lose your appetite or feel nauseated or constipated for a few days after your surgery. And the pain medications that we give you kind of do sometimes aggravate that problem, so you will be started on a stool softener post-operatively. Please be aware that during your hospital stay, you will need to be monitored closely, especially the night of your surgery. So please know ahead of time that the hospital staff will be coming into your room to check your temperature, to check your pulses, to check your vital signs and your oxygen saturations. So just know ahead of time that there will be disruptions to your sleep. We apologize for that in advance. We do make efforts to minimize those disruptions by consolidating those visits as much as possible. And when Libby and Sharon, the physical therapist, talked to you, they did let you know that physical therapy will be evaluating you the day of your surgery. The goal with physical therapy is to get up, sit in the chair, do some exercises, and take some steps. And that is based on evidence-based medicine that early ambulation is one of the most important things you can do to have a successful knee or joint replacement these days. Also, the nurse case managers will see you to begin your discharge process. It will either be me, Vicki, the other case manager is Margaret. She's going to be speaking with you shortly. Or also we have a couple of floor nurses that help us. It will be Kim or Anya. So somebody will see you the day of your surgery to begin your discharge planning. We have included in your PowerPoint also another slide on the incentive spirometer. The nurses, again, are here to help with that. Please feel free to ask them if you have any questions, but we have included it in your PowerPoint for some more reading if you'd like. We have also included the information on the pain scale that I spoke of earlier. Remember that you are not being a bother if you ask for pain medication. You've had a major surgery, you're going to have pain. The nurses will medicate you and it will help alleviate the pain, but we just need for you to let us know how you're feeling, and we're going to do our best to make you feel better. It won't take all of your pain away, but it will take the edge off. But the goal with pain is that we want you to take your pain medication so you'll be able to participate fully with physical therapy, because completing your physical therapy is the way you get your range of motion and your strength back. That's the most important thing for you right now. So just know that they're going to be working with you and they'll be giving you pain medication. So the first day after your surgery, they're going to come in really early, post-op day 1, and draw labs. The reason that we get labs early is so they're ready when your doctor rounds and he can see your results of your labs. So they're coming early to get your labs. Physical therapy will see you 1 or 2 times this day. Remember to have all that information for the therapist about stairs or steps at your home, and if you and the height of your mattress up and down. Walking is the goal for this day, and you will be up in the chair for the biggest part of the day. Again, the bed is not necessarily your friend after an elective surgery. We do want for you to be up and in the chair. We like for you to have all your meals in the chair, and our goal is to get you up and get you moving. Continue to use your incentive spirometer. If you've had a knee replacement, a lot of times they do put a nerve block in, and that knee feels heavy at first, but that will wear off. And most all of our patients do go home day after surgery. So be sure and have someone ready to help you when you get home. Everybody's going to need a coach. Everybody's going to need help. So get your help lined up before you come for your surgery. And we wish for you to have the most successful surgery. Remember that we're here to help you throughout the process. Case management's number is in your PowerPoint. And we will see you when you come for your surgery. At this time, we're going to let the nutritionist, Rachel, come and talk to you. And then Margaret is going to finish out our presentation today. But again, thank you for joining us and thank you for choosing our hospital.
Hi everyone, my name is Rachel Wright. I'm a registered dietitian here at Texas Health Southlake. Nutrition plays a really important role pre and post-op. So I wanted to talk to you a little bit about what you can do to prepare for your surgery to get the best outcomes. Surgery, very similar to sports, actually causes an inflammation response to the body. That can actually cause a deplete in your nutrients and potentially put you at risk for complications post-op, infection being one of the primary risks. As you would prepare for an activity, it's really important to make sure you prepare for your surgery as well too. Protein is the #1 nutrient. If there's anything you're going to take out of what I have to say, it's make sure that you are meeting your protein needs. This is the building blocks of our entire body, and actually next to water, it's the most abundant nutrient in our entire body. It's our hair, nails, muscles. It's part of, makes up our immune system, and so making sure that we have adequate protein intake is essential to making sure that you heal appropriately. So protein comes from all meat sources, so anything that's a meat product is considered a protein. We also have beans, nuts, fish, eggs, milk. Greek yogurt is a great source of protein. Quinoa, cottage cheese, and soy products. Something else that you might consider doing are protein shakes. One side effect, especially post-op, is going to be a decrease in your appetite. You also will not be as mobile. So having some protein shakes available that you can just reach for and drink when you're maybe not feeling so well is a really good way for you to make sure that you're still meeting your protein needs. I drink protein shakes for breakfast as a type of a meal replacement. My favorite is Premier Protein. However, you can get that at Costco, Walmart, any pharmacy. The Evolve is really good too. So if you are plant-based, you can use that. Ensure, Glucerna, those are the ones that we use in the hospital. So Glucerna is for our diabetic friends, but these are good ways to make sure that you are having protein. And I encourage that at every meal. Here are your protein needs for someone after major surgery. So you actually have an increased need post-op for protein on top of your normal protein intake. So this is just a general recommendation for the general population. If you do have any questions or any specific recommendations that your doctors might have given you about protein, specifically for renal or kidney patients, if you have any questions, my contact information will be at the end of my slides, and you're more than welcome to give me a call. So these are general recommendations based off body weight and how many grams of protein you should be having for the day. And if you do have any questions, the protein is on the back of the nutrition label of any of the foods that you're eating. So if you're wondering about where you get that information. The next nutrient that really does play an important role is complex carbohydrates. So there's two different kinds of carbs. You have your complex carbs, which are your whole grains, quinoa, oats, wild rice, barley, and so on. And then you have simple carbs. So those are going to be more of your sugary sweets, white table sugar, things like that. Now, with complex carbohydrates, why we're recommending this, A, it's providing us the energy that we need to heal, and it's also providing us an ample amount of fiber. So fiber is really important for preventing constipation. Again, one of the side effects post-op is constipation. So this is going to be a really good way to kind of help to make sure that you're combating that, is making sure you're having enough fiber in your diet. What we don't encourage is intake of simple carbohydrates. So those, again, refined sugars, they'll actually spike the blood sugar and then can put you at an increased risk for infection. Now, that doesn't mean you can't have a cookie, but we definitely encourage you to make at least half your grains or half your carbohydrates coming from a complex or a whole source. Healthy fats. So healthy fats like olive oil, salmon, fatty fish, avocados, nuts, seeds, and nut butters, these have actually all been shown to decrease inflammation. So our body has gone through this stress stimulus, that is surgery. We are inflamed. What we want is to help bring that inflammation down. So incorporating a heart-healthy fat at mealtime, cooking with olive oil, this is a really good way to help kind of reduce that inflammation. Here is a list of vitamins, minerals, and water. Vitamin C is an antioxidant that it's important for your skin, bones, and connective tissue, so this really helps with healing as well too. Vitamin A, zinc, and iron. There are some food sources listed here, but I wouldn't focus in on making sure you're getting specific foods. Oh, I need to have this, I need to have that. Eat a rainbow. It's basically what I tell everybody, just to kind of simplify everything so you're not getting so overwhelmed on the little tiny vitamins and minerals. The more colorful you make your plate, the more that you're going to be meeting all of your vitamin and mineral needs, because all of our vitamin and minerals play a part in good nutrition and good health. These are just a couple specific ones I kind of zeroed in on. So just eat a rainbow, make your plate as colorful as possible. Lastly, water is very important as well too. So that is going to help maintain adequate hydration and preventing constipation. So making sure that you stay hydrated, and more than just water counts as fluid. You could even just do jello or broth and still stay hydrated. So making sure that you are meeting your fluid needs during this time too will help with healing. The last slide I have here is a healthy plate, and this is from the Harvard School of Public Health. And what I really like about this plate is we've transitioned out of using the food pyramid. We're not really using that anymore, but what we've done is we've taken the food groups and we've put it onto a plate. So this is something that you can mimic at lunch and dinner times to make sure that you are meeting a balanced meal. So instead of trying to fumble around with number of carbs and number of protein and grams of fat, if you just kind of focus in on this plate and do your best to mimic the portion sizes of your food groups right here, you'll be sure to be meeting your nutritional needs. There are some recommendations on there. First off, I tell my clients half plate healthy. If that's one place you can start, half plate healthy. So half your plate is being made of vegetables and fruit. From there, we do about a quarter of your plate a healthy protein, or your fist or a deck of cards is another common portion size. So a quarter of your plate a healthy protein, and then a quarter of your plate those whole grains. And again, that's where we're looking for those complex carbohydrates to come from in that whole grain category. It mentions water, making sure you're staying hydrated, and then it has the healthy fat section added on there too. So any questions with this? Here is my contact information. Please feel free to give me a call, shoot me an email. I am available for any type of questions. We do offer outpatient nutrition counseling here at Texas Health Southlake. All we require is a physician's referral. Thank you guys so much, and good luck with your surgery.
Hi, my name is Margaret, and I'm another case manager here at Texas Health here at Southlake. I'm here to talk to you about discharge planning. Vicki has already gone into getting help at home and having someone to help you and check on you and drive you to your follow-up appointments. I'm here to talk more about the equipment and the home health. So the equipment that you need, all our doctors order a rolling walker and a 3-in-1 bedside commode for home use. All insurance companies will cover the rolling walker, and Sharon showed you the type that we need. And some insurances won't cover the 3-in-1 bedside commode, but if you'll call us and we can go over your insurance with you, we could tell you if it's covered or not. But we will also let you know that when you arrive to the hospital. We will be setting up the equipment and arranging your home health. Each surgeon has their own preferences for home health. One of our surgeons, his office arranges it. The other one will tell you what his preferences are when you come in. You don't have to do anything ahead of time. The incentive spirometer will go home with you. You're going to continue to do that. We will be giving you prescriptions for the pain medicine and the blood thinners. Most of our patients will go home on aspirin as a blood thinner, but it depends on your surgeon, so that's something that we'll work out with you when you're here. And you will take your compression hose home with you. They're knee-high. You're going to be wearing a matching set of 2. and you need to wash them and hang them up to dry at home. Do not put them in your washing machine or put them in your dryer, because they'll come out about that big and you can wear them on your fingers, and your house will smell like a burnt tire. So we'll hand wash and hang them up, and then you can put them back on. You need to inspect your skin to make sure you don't have any sores or irritation underneath those compression hose. We will send you home with wound care dressings. You'll go home with 2 dressings. One of our surgeons, if you're not, your wound is dry and not oozing, you'll go home with just open to air. The discharge planning starts before admission, so we kind of like to get your preferences ahead of time. So we will work with you when you come in. All of our surgeons prefer for you to be discharged home. So that's why we emphasize having someone to help you at home and help you with your daily activities. Most surgeons will order home health physical therapy. Some will order outpatient physical therapy, and that we will know upon your surgery date. The home health physical therapy is where the therapist will come to your house 2 to 3 times a week for about 2 weeks or 3 weeks, depending on the doctor's order, to keep your physical therapy going. Home health physical therapy is for the homebound patient. Homebound is the expectation of your insurance company that you will be homebound. You can't jump in the car and run out to the store or anything. There's not a camera following you around. Make sure you don't go to Applebee's or anywhere, but the expectation is that you are basically at home. You can go to your place of worship and to your doctor's office. The equipment that the doctors order for you is a rolling walker and a 3-in-1 bedside commode. We will arrange that with you, and our phone number is on this slide in the presentation, so you can call us for any questions. When you're at home, we need you to follow the discharge instructions given to you by the hospital staff when you leave. Your physician's specific instructions are in there. You're going to take your pain medicine as prescribed by your doctor. I give my patients pain medicine when they're here before breakfast, because therapy will see you after breakfast, and then a medication with lunch, because therapy sees you after lunch. While you're at home, your therapist will call you and say, I'm going to be there at 10 o'clock. We'd like you to take your pain medicine about an hour before they get there, so it's on board and circulating, so you can get up and move with them instead of saying, oh, I'm hurting too bad, I can't do my therapy today. You need to do your therapy to make sure you get what you want out of your new joint. You're going to continue to use your incentives barometer, and you're going to continue to wear those lovely knee-high white stockings for about 6 weeks. That's why you need to wash them and hang them up to dry. While you're at home, you need to watch for signs and symptoms of an infection. A temperature above 101.5, redness around your incision, drainage from your incision, hot feeling from around your incision, and pain not controlled by the pain medication. If you're taking your pain medication and your pain goes from a 5 to a 3, it's working. If you're taking your pain medication, your pain's a 5 and it's a 8 or 10 and the pain medicine isn't helping, it doesn't mean you got addicted overnight. It means something could be wrong, and if any of those occur that I just mentioned, you need to call your doctor's office and they will advise you on what you need to do. Vicki had talked about the knee-high stockings and the plasma flow, little things that wrap around your calf. That's to prevent a DVT, a blood clot. So if you have redness and swelling in your thigh, calf, or ankle that doesn't go down with rest and elevation, increased pain or tenderness in your calf, thigh, or groin, warmth in the affected area, you need to call your surgeon's office. If any of those occur, he will advise you on what they would like you to do. Signs and symptoms of a pulmonary embolus is a blood clot that has gone to your lungs. There's commercials on TV now about DVTs and PEs, so everybody should be pretty familiar with the words. But if you develop sudden shortness of breath, chest pain, difficulty breathing, pain between your shoulder blades, sweating, confusion, dizziness, that is a 911 emergency. That's not call the doctor and wait for him to call you back. It's call 911 and go to the nearest hospital. The ambulance will take you to the nearest medical hospital, and if you have a family member drive you, you need to get to an ER. Some common things after surgery for a total knee replacement is that your knee may click. You won't be able to sneak up on people. Your knee may click. You may feel lateral numbness along the outside of your knee, and your joint, your hip or your knee may feel warm up to a year. All of those are normal. You don't need to panic. And then if you have any questions or problems, please call us to our confidential voicemail, and we will get back to you with the answers the best that we can. And we will be happy to help you along your journey. Thank you for choosing us, and we look forward to serving you when you arrive.